Hello, my name is Jennifer. I'm in Kim Foster's Veterinary Technician program, and today I will be showing you guys how to apply proper feline restraint. I'm going to be starting with how to use a cat bag. So this is our cat bag. We're going to have the head of the patient going this way and the butt of the patient going this way. I've opened the cat bag, just unzip the zipper and undo the Velcro that goes around the head. I'm going to place the patient in the bag. Preferably laying down if you can. Make sure you get them all in there. And then we're going to zip them up. Put the head in, put the Velcro on, and then start zipping the rest of the way. Cat's got a little bit of longer fur, so the Velcro's not wanting to stick. Alrighty, so now I have our patient in our cat bag. He is completely zipped up. I have full mobility of him. I can move him. I can open my zippers to access my points. Like if I need my arm, just open this, and I have my arm available. Zip it right back up. And that is how you apply a cat in a cat bag. So now what I'm going to do with our feline patient is apply something called a stretch technique lateral recumbency. Now this can be a little bit stressful for some patients and should really only be applied if the patient is really difficult and you just need to get a blood draw or a vaccine done very quickly. So what I'm going to do is I'm going to scruff my patient. I'm going to put my arm along his spine to help stabilize. I'm going to pick up his rump with my right hand. I'm going to follow him down. I'm going to grab his back 2 feet in my other hand, and I'm just going to gently pull. You don't want to pull so hard that you're going to hurt the cat. And then you want to, with the arm you're scruffing with, apply pressure to the spine to allow the cat to have more stability depending on what the doctor needs to do with him. And that's how you apply stretch recumbency. Hello, I am now going to show you how to apply a towel technique for restraint in cats. So I have a towel laid out and my patient facing away from me. I'm going to bring the edge of the towel up under the patient's chin and wrap this side tight over the patient. This side again is going to also go over. Want to make sure that it's nice and snug around those front feet so that he can't pull them out and try and snap or grab at us. And he is in there. You can tell that his feet are fully in here and his head is also in control. I have him stabilized on both sides, and I place my hand at the back away from his mouth so that I can just have use of the space to keep him from trying to bite people. And if he is wiggly or thrashing around, I can easily kind of manipulate him to which direction I want. And if we needed to do something with him back here, he's nice and secure up here, and then we can work and do what we need to do in the back. We just unroll the towel and do the vaccines or whatever procedure we need to do. And that's how you do restraint with a towel. I am now going to show you how to apply a feline muzzle. So here's my patient. I have him facing away from me. I have our feline muzzle here. You're going to have the part with the most fabric on top. This is going to go over the eyes. That is the bottom part that's going to go under the chin. So I'm going to put the muzzle on, make sure that it's a good size, good fit, and then I'm going to apply the Velcro around the back as tight as I can, but not too tight. And that is how you apply a feline muzzle. Hello, I am going to show you how to remove a feline patient from an upper cage that is at your eye level or above. So what I'm going to do to start is come up to my cage. I'm going to first look into the cage and see where the patient is, kind of assess the body language. Depending on what they're giving you, if they're hissing, that's going to determine how quickly I move into the cage. So I'm going to go ahead and open. I like to, especially with felines, open the doors as quietly as possible, kind of limit the stressors. Next thing I do is I grab the towel that they're sitting on the bottom. I'll bring my hand under and just pick up the patient by the stomach area. And I also have his arm in one of my hands. Next thing I do is I'm going to grab him from the back and under the chest and lift up. And I'm going to bring him down, hold him under my arm, and have both of his arms in my hand like this so that I have control. He's not trying to jump away or run away or anything like that. And that's how you remove a feline from an upper cage. I am now going to show you how to remove a feline patient from a lower kennel. So similarly with the upper kennel, you want to look, see where your patient is first. Again, read their body language, move slowly, don't make a whole lot of noise. It's just going to make your job easier when you're starting off with a more calm patient rather than a scared one. So I kneel down rather. I'm going to open the cage. And this guy's already kind of coming up to me here. So I'm going to put my hand in here to make sure he doesn't try to jump out or anything like that. I'm going to just introduce myself and pick him up slowly. And then I'm going to put him in my arms and remove him from the kennel, and that's how you remove a feline from a lower cage.